Welcome to the News at 10. I'm Abby Wilt. A growing list of Idahoans are now in key positions within the Trump administration. That includes the former director of Idaho Health and Welfare, Alex Adams. He was selected by the White House to try and take what he accomplished in Idaho to share with the nation. Joe Paris, I know you sat down with him this week. What were the key takeaways?
Well, he's really looking to improve foster care across the country, like he tried to do here in Idaho. And looking to improve that system is not something new to Dr. Adams. He worked on it for quite some time here in the Gem State. A big jump from the Gem State to our nation's capital. Work is just beginning for Dr. Alex Adams.
I was sworn in as the Assistant Secretary of Health and Human Services. My part of the portfolio at HHS is overseeing the Administration for Children and Families, or ACF for short.
The former director of Idaho's Department of Health and Welfare, Adams spent the better part of a year preparing for a job with the Trump administration. Assistant Secretary with the Administration for Children and Families. A part of the process, answering questions from American senators about how he plans to embrace change and help those who need it most in our foster care system.
Do you agree that better data collection will help improve recruitment efforts established by these recruitment plans? If yes, say why.
Recruiting and retaining qualified foster families is absolutely critical. In Idaho, we took a data-driven approach to that, so I do think having states oriented around data is going to be critical. At ACF, we oversee a whole host of programs, but the Children's Bureau is our oldest program, and it oversees foster care, adoption, guardianship assistance, and all of those programs, but also oversee Head Start, TANF, child care subsidy, et cetera, et cetera.
What were you hoping to take from Department of Health and Welfare in Idaho and kind of share on the national stage?
I was very proud of what we did in Idaho for child welfare. I mean, when I started, we had too few foster homes. We had kids sleeping in short-term rentals. We had kids in non-traditional settings. We were bursting at the seams. And what we did in Idaho is we boiled it down to a singular metric. We created a ratio of foster homes to foster kids, and said we're going to do things to get our numerator up, the number of homes up, and we're going to get our denominator down by focusing on effective prevention, specifically mental health and substance use treatment and prevention services. When I started in Idaho, we had 74 homes for every 100 kids coming into the system. When I left Idaho, we had 104 homes for every 100 kids coming into the system. We were able to shut down every short-term rental. We were able to get all kids in more appropriate settings, and hoping to bring some of that thinking to the national level. Just this week, we launched our Home for Every Child campaign, where we're going to start measuring each state's ratio and putting incentives in place to help states get their ratio of foster homes relative to the number of foster kids up.
A special executive order organized by First Lady Melania Trump, fostering the future for American children and families. Adams stood alongside the president and First Lady for the launch.
President Trump and the First Lady have a soft spot for foster care, and First Lady in particular has been leading on this issue for years. She has, in the most literal sense, put her own resources to benefiting older foster youth. And they signed an executive order reaffirming this nation's commitment to our most vulnerable children. It directs my agency and others within the federal government to take specific actions, gave us 180 days to take actions. We're going to do some of these things in 180 hours. Starting next week, we're going to start letting some of the pressure out of state administrative burden. We've got a roundtable to advance AI and child welfare and some of those things. But really kudos to the First Lady and the President for leading on this issue, putting a flag in the ground and saying, we must do things better, we can do things better, and we will.
Adams took on the opportunity as he led meaningful change in Idaho's foster care system. It was a conversation with his wife that pushed him to take the leap.
Said, if you want to do it, I'm in. So the next hurdle to get over is just the mental one. I had just started at the Idaho Department of Health and Welfare. I felt like we had a lot of wind at our backs. We were making a lot of momentum. I had a lot of trusted relationships in the legislature, and I felt I was in a position to make a difference there. So then it came down to, did I think I could make a difference at the federal level? I saw a president and first lady who were committed to this foster care issue. They demonstrated that with their executive order on fostering the future. I ran towards this because I thought what we were doing in Idaho was a good model for other states, and thought I could make a difference for children throughout the nation.
Work is just beginning, but Adams already has eyes on accomplishment.
Success for me looks like when I leave this job, having a lot more than 57 homes per 100 kids. Ideally, every state would be above 1.
And Dr. Adams certainly has his work cut out for him. Abby, he says, again, as you heard him mention to me, he's going to be incentivizing, working with the states to improve their systems. It is a much different role being at the federal level, working with the states, but he believes he has great partnerships and great relationships to kind of do what he did on the local level here in Idaho for our whole country.
Definitely important work that he's doing. Thank you, Joe.